Hello, I'm Dr. Bob Murry, the Chief Medical Officer at NextGen Healthcare. In today's NextGen Office Minute, we're going to look at how to use the custom check-in process for patient check-in in the NextGen Office EHR. There's a list of available forms on the left, and then the standard check-in forms on the right. If I don't customize anything else, this is what all the patients are prompted to answer before their appointment in the primary care setting. At the bare minimum, we recommend at least using new patient versus established patient for customized check-in. Now, some practices will also have a well visit check-in or a sick visit check-in, a diabetes follow-up check-in, just as some common examples. You're able to customize those here by designing custom form check-ins based on and off each visit type. You can eliminate items for the check-in by clicking on the X here to clean up the list and make it a simpler checklist for patients. If you custom build either from the NextGen Office standard forms or things that you build on your own, you have the ability to drag and drop those into this process and move them into a different area, as well as establish a priority those forms should take. From there, once I set up this check-in process on the patient side, when they log into the patient portal, they'll have an appointment up in the upper right. It'll give them the appointment check-in option. And then all of those questionnaires and forms are populating here for the patients to complete. Everything that the patient does here formats into structured data within NextGen Office. So the allergies are going to show up in the allergy section, the medications on the med list, and so on. Now your staff will always have the final say as to what gets stored in the permanent chart record as well. There's a checkbox that says to accept or dismiss those changes in the patient record. But this can save a lot of time in the patient check-in process. Patients should be filling out these forms before they get to the office, and that way they will not need to do it on paper and have your staff enter it for them into the EHR. These forms are available in over 70 languages, and so if the patient is more comfortable answering the forms in Spanish, for instance, it will translate everything back into English in the EHR. And that has been today's NextGen Office Minute.